it's Sarah Wu, and I want to tell you a lot about speech pathology as a profession. I know that you are interested in speech therapy, and I have actually been doing this for a long time. I'm just finishing up my 12th year, and before I did this, I actually worked for Kraft Foods for 4 years, so I've been in the corporate environment. I know what that's like, and I was ready for a change, and so I went back to school and became a speech pathologist. And what does a speech pathologist really do? So first of all, you need to know the settings we work in. Essentially, there are two main settings: education and medical settings. So like right now I'm in a clinic, but it would be considered more of a medical setting. And I worked in the schools for all these many years, so I've certainly seen a lot. Most speech pathologists actually work in the schools. More than 50% work in the schools. I also wanted to tell you a little bit more about like what it is exactly that we do. There are many different things that we treat, and the one that I think most people really think about when they think about a speech pathologist is speech sound articulation. So that is something that we do. I've done a ton of it. I help kids learn how to say sounds right so that they're more intelligible when they communicate. And then another main area that I work in is language disorders or delays. That means that somebody is having trouble with comprehension of oral information or expression of oral information, or both. That can be a delay for when a little kid maybe struggles and is just behind, or it can be a disorder where they're actually processing information a little more differently than others, and it's considered a disorder versus a delay. There may not be a catch-up, so to speak. However, I also do stuttering therapy for people who stutter. It's called fluency. We call it fluency, which can be confusing for somebody coming from a teaching background, because fluency means something else in like when you teach somebody how to read. But fluency disorders refer to when somebody's stuttering and you want to help somebody become more fluent. I also have worked with voice clients. So those are people who struggle to produce sound from their voice. And so this is usually pretty rare in the pediatric population in terms of like what I would assess or treat. So that's been an extremely small part of my job. But articulation and language, those two areas are pretty big in what I've done. I think making that choice between like the pediatric and the adult population is something that many people find to be pretty clear, depending on your personality. But other people like to work with all different kinds of clients throughout their lifespan. So I would say that if you like kids and you want to do play-based therapy, you don't mind doing play-based therapy, you're going to want to work with kids. Kids aren't going to really totally understand why they're there working with you sometimes, and there's a lack of awareness about why. So that can make therapy really fun, and sometimes they just think they were playing games instead of realizing that they actually did a bunch of work. And on the other side, so if you're the kind of person that wants to work with a client that, for example, understands and has awareness about why they're there, an adult population might work really well for you. And a lot of the disorders you see with adults are different than the ones you see with kids. You're going to be working on mostly language disorders. So a lot of the adults that are coming to see you have just experienced some kind of potential brain injury. So you're working with traumatic brain injury as a primary diagnosis. You're going to be working with people who've had a stroke and are learning to communicate. Also people who've had some kind of cancer and they're learning how to talk again. So a lot of times, this is my personal opinion, others might feel differently. It can be kind of a sad time for that client and the family, and they're going through a lot, they really need a lot of support, and you're there, and you're really, really valued. And so that's something to think about. Where with kids, a lot of kids, it can also be sad, but depending on the families or what's happening, and if there's other things going on with them in terms of like learning disabilities. Families can be sad, but there's a lot more hope because they're young, and you see, for me personally, I feel like I see more progress, and that can be rewarding as a clinician. Yeah, so if you have any questions, feel free to let me know. I'm on Instagram, Sarah Wu SLP. Feel free to comment below, and I also have an ebook that you're welcome to buy. I'll leave a link below, but please like and subscribe because I'm going to be sharing a ton more speech therapy stuff, and I really appreciate your time. Thank you.